Are you prepared for the massive shift coming to your bank account and your healthcare on January 1st, or are you just going to let the December 7th deadline pass you by and hope for the best? Because let me tell you, hope is not a financial plan, especially not when it comes to Medicare in 2026. Listen to me, because this is your money and your life we are talking about. Every year, from October 15th to December 7th, you have this window. It's called the open enrollment period. And for 2026, the stakes have never been higher. If you are sitting there thinking, Susie, I like my plan, I'm just going to stay put, you are making a potentially devastating mistake. Why? Because the plans are changing, the costs are changing, and the law has changed in ways that could save you thousands, but only if you take action now. The fear I hear from so many of you is that you're going to be priced out of your own health. You see the Part B premiums going up, and yes, they are projected to rise to about $202.90 a month for most of you. You see the deductibles climbing. It feels like you're falling behind even with a Social Security COLA increase. But here is the truth, while some costs are going up, there are new protections in place for 2026 that are absolute game changers for your out-of-pocket spending. Let's talk about the big one, prescription drugs. For the first time, we have a firm, hard cap on what you will pay out of pocket for Part D drugs. In 2026, that cap is $2,100. Now, I know $2,100 sounds like a lot of money, but compared to years past where people were spending $5,000, $10,000, or even more on life-saving medications, this is a safety net you have never had before. If you hit that $2,100 mark, you pay zero, absolute zero, for your covered drugs for the rest of the year. But wait, there's a but. This only works if your drugs are on your plan's formulary. That's just a fancy word for the list of drugs they cover. If you don't check your plan during this open enrollment window, and your insurance company dropped your specific medication from their list, that $2,100 cap won't protect you for that drug. Do you see why you cannot afford to be lazy? You must go to Medicare.gov, use the Plan Finder, and put in your specific medications to see which plan treats your wallet the best for 2026. And for those of you who struggle with those big costs at the pharmacy counter in January or February, listen up. The Medicare Prescription Payment Plan is back and it is stronger for 2026. This allows you to spread those out-of-pocket costs over the entire year in monthly installments. No interest. No fees. It's a way to level out your cash flow so you aren't choosing between your pills and your heat in the winter. But you have to opt in. It's not automatic. Now, let's talk about Medicare Advantage, Part C. I know many of you love the $0 premiums and the extra bells and whistles like dental and vision. But I need you to be very careful this year. We are seeing a trend where some big-name insurers are pulling out of certain counties or reducing those extra benefits like over-the-counter allowances and meal deliveries. If you received an annual notice of change in the mail and you threw it in the trash, go get it out. You need to see if your doctors are still in the network and if your copays for specialists are moving higher. In 2026, the maximum out-of-pocket limit for in-network services and Advantage plans is actually dropping slightly to $9,250, but that is still a huge amount of money if you have a health crisis. If you are on an Advantage plan and you're tired of the prior authorizations, where the insurance company has to approve what your doctor says you need, there is a glimmer of hope. Medicare is testing new rules to speed those approvals up, especially for behavioral health, which now has to match the coverage of original Medicare. So, what is your actionable takeaway today? First, you mark December 7th on your calendar in big, red letters. That is the deadline. Do not wait until December 6th when the website crashes or the phone lines are busy. Second, get your Medicare and You 2026 handbook. Look for the sections marked with the blue new icon. That is where the changes are hidden. Third, if you are overwhelmed, call 1-800-MEDICARE or contact your local SHIP, the State Health Insurance Assistance Program. They are free, they are unbiased, and they don't sell insurance. They are there to help you navigate this maze. You have worked too hard for your money to just hand it over to an insurance company because you didn't spend 30 minutes reviewing your options. Be the master of your own financial destiny. Check your drug list, check your doctor network, and make sure your plan for 2026 actually serves you, not the other way around. With that said, thanks for watching, and until next time.